So I want to talk about social contagion now. This isn't a new idea. Social contagions have been around pretty much since humans have been gathering. This is a quote from 1852. "We find that whole communities suddenly fix their minds upon one object and go mad in its pursuit. That millions of people become simultaneously impressed with one delusion and run after it till their attention is caught by some new folly more captivating than the first." We are in the midst of what Lisa Marchiano, this is Lisa Marchiano, if you don't know who she is, you can find her writing all over the place. Lisa, I'm sorry, did I say Linda? No, okay. Lisa says that we're in the midst of a psychic epidemic, which is a phrase that she borrows from Carl Jung, who used it first to describe what the phenomena of millions of Germans going along with the Nazi regime. Thoughts, feelings, behaviors, they're all transmissible. They're as transmissible as the flu. In fact, people who have spent their careers in epidemiology, tracking the spread of infectious diseases, now work on tracking the spread of violence and suicide and other social contagions. Anorexia these are some examples that might be helpful because you'll hear, as I've heard when I've tried to talk to WPATH members about this idea, they mock me and say, "Oh, so you can catch trans like the flu? Do you catch it from, standing next to a trans person?" So here are just a few examples that you can share if you're talking to people in your community. Anorexia and bulimia. So bulimia was never described in literature. It wasn't seen until one psychologist had one patient, and then he wrote about her. And then within a few years, he couldn't find a robust enough sample of these women, but he had heard of about 30 cases, so he wrote it up, and it was actually included in the DSM in the 80s. And a lot of people complained because the sample size wasn't robust enough. Within a number of years, not very long, a couple of years after being described in the media, in the professional literature, the mainstream media picked it up. There was a story in Better Homes and Gardens, and after that story came out, within a year, 15% of female college students were reporting purging behaviors. 30 million people suffered from bulimia within a number of years. And those of you who are my age probably remember it wasn't, right, the girls that were troubled in our peer groups, they weren't trans, they were purging. So we've seen, right, we've all seen this. An interesting story is Fiji. Some sociologists wanted to try to figure out how this was happening, this spread. And so they went to Fiji, which had 0 reported cases of bulimia, because all of a sudden in 1995, there was a huge explosion of cases. So they traveled there trying to figure out what had happened. Well, what had happened was 1995 was the year that Fiji got television. And when they got television, 2 of the programs were Beverly Hills 90210, and what was the other one? Melrose Place. So, that was in 1995. By 1998, 29% of young girls in Fiji reported purging. By 2007, 45%. Divorce is contagious. If somebody in your close circle of friends gets divorced, you're 75% more likely to get divorced within the next 2 years than if no one in your circle of friends has recently divorced. Goethe described the Werther effect. Well, the Sorrows of Young Werther in 1774, where the protagonist shoots himself in a very specific way, and then there were copycat suicides. throughout Europe, where young men would dress like Werther had dressed, they would use the same pistol, and they would leave a copy of Goethe's book nearby after they killed themselves. Crime, obviously, we know, right, is socially contagious. So, you guys have seen this, right? And by not describing how a suicide happened, the chance of a copycat suicide decreases by 80%. So by just leaving out that specific aspect of the death, you decrease the likelihood of it happening again. So what are the vectors of contagion how are we seeing this spread? Social learning theory tells us that children learn from those around them, right? This is undoubtable, we know this, or at least we do now. Media, however, is able to transmit ideas much easier than in person. So it's long been known that television transmits ideas better than in person, and the internet obviously is even stronger. So some methods, some vectors of contagion are YouTube. This is a show for kids called Queer Kids that's on YouTube. Curricula, or this kind of material, you guys have probably all seen the genderbread man or the gender unicorn, right?
Yes.
These are materials that they're using with very young children. YouTube. Most of us who have teen daughters who became engaged in these ideas went to YouTube and saw these representations of trans masculine people super excited about hacking off their breasts or growing a beard or whatever. So these are some famous YouTube trans boys. And some also, I'm non-binary and I'm on testosterone, right? Well, I'll talk about that a little bit later. But it used to be, right, that hormones were kind of a last resort, only for the most truly dysphoric children who were likely to kill themselves if they couldn't transition. Now it's just a way to affirm your identity. You don't have to be trans or dysphoric.
Wow.
So we transmit, right, ideas, behaviors, and emotions. So this is just to kind of give you, and this is not exhaustive by any means, but so the idea that's being transmitted is distress over your sex body, basically, or that something's incongruent, something's wrong. The behaviors that come about are binding, name, gender changes, and hormones surgery. The emotions obviously are vulnerable, special, and a unique oppressed class of human beings. The picture's from DeviantArt or Tumblr, I think. So most of us know this. I'm just going to really quickly go through, and like Marion already talked about some of this. But so how did this happen? Prior to the 1990s, gender dysphoria in youth, it wasn't even really called gender dysphoria, but it was treated as a mental health condition. So there was a mental health model to help these children. You guys have probably all heard of Kenneth Zucker and his CAMH clinic in Toronto that was shut down. Kenneth Zucker, basically, his goal was to help most kids learn to feel okay in their born bodies. A meme that you'll come up against probably is, that he was practicing conversion therapy. He didn't want boy children to play with Barbies, right? There's that drop the Barbie line. A lot of Zucker's kids were probably on the autism spectrum. And so actually the whole drop the Barbie thing, it was more about negotiating with children who were fixated on something. So it wasn't drop the Barbie and go play with a truck. It was, hey, let's play with something else for a little while. In the 1990s, the Dutch first used puberty blockers with transgender children. We talked about puberty blockers earlier, and you guys all know, right, the dangers? Okay.
Did they do this on both boys and girls? Yes.
Yeah, actually, the longest term study that we have is of she's probably about 30 now, but it was a natal female who was blocked really early by the Dutch. It's just one case study. In 2007, Norman Spack, who was at Boston Children's Hospital, went over to the Netherlands to learn from the Dutch, and I have a quote in here, but in an interview with, I think it's the New York Times, he said as soon as he found out about it, he was salivating. He couldn't wait to bring it here. And he did. He brought the Dutch protocol here in 2007. In 2009, the Endocrine Society issued guidelines. It's still off-label. There's still really no robust long-term studies. Today, there are no regulations in the United States whatsoever. Blockers are usually started in Tanner 2 with the youngest children who display dysphoria early, and then cross-sex hormones begin around 12 or 13. Surgery is happening in our country in children as young as 13. In 2013, there were five university children's hospitals who had small little gender clinics. Today, and this is old, it might be more, today there are close to 50. And these are just the large university-affiliated or hospital-affiliated clinics. This doesn't include Planned Parenthood. It doesn't include family practitioners who will prescribe hormones or other little small independent clinics. There's Norman Spack. I was salivating. WPATH, does everybody know the World Professional Association of Transgender Health? Which is not a professional organization at all. A lot of its members are just activists, not medical professionals. But they basically are in charge of the standards of care. And this is from 2011. So it went from a last resort, and this is really important to understand how this happened. It went from a last resort to it not being a neutral option. Risks of withholding medical treatment for adolescents. Refusing timely medical interventions for adolescents might prolong gender dysphoria and contribute to an appearance that could provoke abuse and stigmatization. As the level of gender-related abuse is strongly associated with the degree of psychiatric distress during adolescence, withholding puberty suppression and subsequent feminizing or masculinizing hormone therapy is not a neutral option for adolescents. So this idea of passing, right, that if we can help a child pass better, completely surface, that they'll be safer. They won't kill themselves, they won't become prostituted, they won't become drug addicts, they won't, go onto the streets. This is Kelly Winters, a late transitioning trans woman who transitioned later in life after a very successful career in a male field. And Kelly Winters, this is just she's also on the International Advisory Panel for WPATH, and is really influential. Recent comment from Facebook. We know a great deal about the impact of the alternative on mood and consequences. A parent asked, what about depression, right? The FDA mandated in 2017 that the makers of Lupron include a warning for suicidal ideation, depression, and other emotional side effects. Kelly Winters tells us that the consequences of incongruent puberty and the resulting disfigurement and extreme risk of suicide, right? How can we argue with a little bit of depression? We have Prozac. This is a video clip from, is it not gonna? So something that parents of gender atypical and dysphoric youth find out very quickly, thanks, is that we're threatened. We are bludgeoned with the threat of suicide. That if we do not affirm our children's identity and agree to whatever medical pathways our children want, they'll kill themselves or leave home and never speak to us again. And this is Joel Baum, who is sitting next to Diane Ehrensaft. I really wanted to do like a most wanted who's who. These two, along with Joanna Olsen Kennedy, these are like some of the worst. Gender Spectrum is probably the largest youth advocacy group in the US. So here he is talking to a group of parents.
At the end of the day, it is the parents' call. Our hope is that they will truly make an informed decision. And I feel like one of our roles is to say, just make sure you have all the information to make that decision. You can either have grandchildren or not have a kid anymore, either because they've ended the relationship with you, or in some cases because they've chosen a more dangerous path for themselves. And
Did you guys hear that?
Yeah.
You can either have grandchildren, right, or, yeah. So, and then he goes on to basically tell parents that they need to go out and talk to the other parents because he can't convince parents to agree to medicalization, but they can. I have links for that's a 5-hour conference. That yeah.
So the context for that is they were talking about how blockers followed by cross-sex hormones sterilizes kids 100% of the time.
Right. So this was about, Erin Saft had just finished talking about how altruistic trans kids are. They don't care that they're losing their fertility because they'll just adopt. And I don't know why, but I can't get to my next.
I never think outside the videos.
There we go. Okay. Okay, so this is basically where we are now. So current situation. Again, we in the US, we have no numbers. But in the United Kingdom, in England, these are numbers from the Tavistock Clinic, which is the only pediatric gender clinic that is on their National Health Service. These are notes from Polly Carmichael, who is the director of that clinic. So of all the children who come in, only 40% are put on a medical pathway. However, 95% of the kids who are put on on puberty blockers go on to cross-sex hormones. 60% of the males are same-sex attracted, 80% of the females are same-sex attracted. In the Netherlands, only 25% of kids who go to the one gender clinic are put on a medical pathway on puberty blockers. 100% of those children go on to cross-sex hormones. 94% of the males are same-sex attracted, and 100% of the females. So one of the things that 4th Wave combats all the time, and I'll talk about this again later, is this idea that puberty blockers are fully reversible and totally harmless, and that they're a pause button, right? It's not a pause button when 90 to 100% of children go on to use cross-sex hormones. It locks in this trans identification. This is a quote from Dan Karasik, and who is a psychiatrist, and Christine Milrod, another late in life transitioned female, in a paper that they published where they interviewed a bunch of surgeons who were conducting bottom surgery to see if they'd be willing to operate on minors. They found that quite a few of them already were, in fact, and for some reason I don't have that number. I think they interviewed 20 surgeons, and 11 of those surgeons had already performed bottom surgery on minors. This is a quote from one of the surgeons. The term Wild West was used by a few highly experienced surgeons who were alarmed at the absence of surgical standards and the ease of entering the subspecialty without any documented training. So you can, if you're a plastic surgeon, you can basically just put out a shingle. This is from a recent court decision. This is a quote from, there was a custody case that was decided just a few months ago of a trans identifying teen whose parents didn't want him to transition, but his grandparents were supportive. The grandparents were awarded custody. The teen was 17, so it wasn't such a huge deal. But Dr. Conrad from the Children's Hospital of Cincinnati testified at that court hearing, and this is from the decision where the judge was concerned that Conrad's testimony, in her testimony, she said that 100% of the children seen at the clinic qualified for services. So that's very different from the United Kingdom, where they practice watchful waiting, and the Netherlands, right, with the 42 and 27%. This is a really hard paper to read. It was published just a few months ago by Joanna Olson Kennedy at UCSF, and it is her, yay, chest surgery is great for young people. She saw there were 332 girls who were eligible for mastectomy in her clinic. Of those 332 girls, she put 94 through for surgery. The youngest was 13. 94, yeah. This is just, the descriptive characteristics of the study. 6 of the girls had been on testosterone for less than 5 months. This is from the Endocrine Society guidelines. This is the amount in orange down at the bottom that a transgender male, that's the amount of testosterone that they would be using compared to PCOS or a tumor, the amount of testosterone that would be in their body. So I said earlier that it used to be that these treatments were reserved for the most dysphoric children, right? That last resort. This is a slide, again, Joanna Olson Kennedy, presenting at US PATH at their first meeting in Los Angeles last year, where she was arguing that non-binary kids also deserve hormones and surgery. It doesn't matter, identity can be neither male or female or both. So they're not locked into this binary idea of themselves, an individualized pathway. Gender is often fluid, changes over time, or fluctuates. It does not cause distress. Notice, children without dysphoria are eligible for surgery and hormones. This is what comfortable and authentic looks like. Some youth will settle on an androgynous presentation. They may or may not choose hormones or cross-sex or surgery for their lifetime. They may or may not, right? Rapid onset gender dysphoria. So this is what our girls are seeing, right? This is from DeviantArt. This is from a popular FTM, just art, where girls upload their dysphoric art. Rapid onset gender dysphoria was recently described in an abstract to a poster presentation for a survey conducted by Lisa Littman. This is important. Don't say that it was a published study, because it wasn't, not yet. We are hoping that her study will be published very soon, but it hasn't yet. It was a poster abstract, and she was the first one to name it. It's since been used by Polly Carmichael in the United Kingdom. She used it just a few weeks ago in a presentation. She did use scare quotes, but she mentioned it. And she wasn't disparaging when she spoke about it. Michael Bailey and Ray Blanchard, they've talked about rapid onset on 4thWaveNow. There's a wonderful post by them called "There Are Many Forms of Dysphoria." So it's mostly...
Deborah So just did a podcast.
Deborah So just mentioned it, that's right, for Quillette. She did a podcast with Jonathan Kay.
And they interviewed Susan Bradley.
And they interviewed Susan Bradley, who was Ken Zucker's mentor. She founded the CAMH clinic. It's mostly seen in females. It's a sudden distress over your sexed body. Ken Zucker and Susan Bradley, when they would talk about dysphoria, what they found was that, and they were mostly talking about males, right, about boys. So for these boys, it was the dysphoria and this feeling that they were in the wrong body was something that was revealed over time. Zucker is clear that this is acquired suddenly, right? And it's acquired through social contagion. My daughter was happily gender atypical, non-conforming her whole life. It wasn't until she encountered the idea through friends and social media that because she was female and didn't want to ever wear a dress or kiss a boy or have a baby, and that she liked, bugs instead of Barbies, that there was something wrong with her. So the distress came from outside. It wasn't an internalized feeling of wrongness. Again, the vectors, right? The internet, YouTube, Tumblr, right? But also the media. Every story that we see about trans children paints them as brave and courageous and wonderful and special, right? There's no critical theory whatsoever. I think there have been 2 stories about, profiles of detransitioned women in the mainstream media, and they don't receive attention. These are, again, numbers from Tavistock. I'm so envious of these national health services and their data. So these are the numbers, basically 0 cases in 2009. This is from 2016 to 2017. I think this number jumped above the 1,500 mark to like 2,600 this year. And as you can see, right, girls more than boys. So what are the reasons for rapid onset gender dysphoria? Obviously social contagion, right? But also this latent cultural and internalized lesbophobia. There's a study that looked at children in the 9th grade and whether or not they were the recipients of homophobic name calling, if these kids had been teased for being gay during the school year. By the end of the school year, there was a very strong likelihood that they would have changed their gender identity, that they would come to see themselves as other. Glorification of gender dysphoria and self-diagnosed mental health conditions, right? We see this everywhere with girls in online environments. A lot of girls may just be resisting porn culture. They just don't see themselves in sexualized versions, in representations of what females and female sexuality looks like. A young sister, she's now a young woman, but she thought that she was a boy for a number of years, and she told me that for her, she was completely disgusted by any kind of sexual thoughts or feelings until she decided that she was really a boy. And then it was like her whole sexuality blossomed, and she realized that she wanted to be the one who comes instead of the one who gets cummed on. So this idea that female sexuality means that you're a bottom, you're submissive, you want to get ejaculate all over your face. These ideas are coming to very, very young girls. They can't even envision themselves in a sexual relationship without seeing themselves in this submissive position. Trauma. A lot of these girls have experienced trauma in their lives in some form or another, either sexual, violent. Depending on the country, autism spectrum disorder, 8%, I think up to 12, maybe. The 8% is from Canada. Susan Bradley, again, is an incredible researcher who's putting this data together. And of course, other psychiatric conditions. These are the numbers from Canada. And these are diagnoses by given by a mental health professional, not the kids. I didn't know whether I should include this slide or not, but I figured I'm talking to a bunch of very influential women. I'm sure you've all heard stuff like this before, but this is from a Tumblr blog. It's by a detransitioned, this comment is from a detransitioned young woman, and she says, "How can we say that we are for all females, regardless of their gender identity, while being completely hostile to them? I would have never re-identified and become a rad femme in my first exposure to that ideology, if my first exposure to that ideology was them making fun of trans men, teenaged ones at that. How can we say here we are for GNC, gender nonconforming women, when we mock the ones who got lost in an ideology we are supposedly trying to help them get away from that?" But the amount of hatred I see towards girls who are so mentally broken and confused and just trying to find a place where things maybe make sense and a place where they feel like they belong screams to me a lack of empathy we claim to have, a lack of understanding, a lack of compassion, and a lack of true initiative to change things. We have to make room for these girls who don't want to be girls. I don't know how we'll do that, and I'm pretty much done talking because I want to make this a conversation. But puberty is a natural disaster, right? That's the language that's used to describe natal biological puberty. We have to nip this in the bud before it kills the kid, right? No, all children deserve to pass through puberty with their fertility and sexual function intact. We do not sterilize children in this country. We do not remove their sexual function. Puberty blockers are fully reversible and harmless. I already talked about that. Well, no, they're not. They're not a pause button, they're not reversible. Not if 90 to 100% of children who use them go on to cross-sex hormones. No one is born in the wrong body.